friend, welcome to our channel, Pregnancy Solutions with Gerald Massa. We talk about pregnancy, we talk about solutions, we talk about things that are really so important to you. Let me know if you have any questions for me in regards to causes of cramping in pregnancy. I will make sure that I answer everything in this short discussion we are going to have today on our show. The first cause of cramping in pregnancy, the first cause of cramps in pregnancy is expansion of the uterus. As the baby is growing in the uterus, you realize that there will be increase in size along the uterine wall, along the uterine muscles. Specifically, there is what we call the round ligament, part of the layer of muscle which is covering the uterus. This tends to actually get the expansion, gets the pressure due to the expansion of the uterine wall, and specifically since the body is well supplied with nerves, then there's going to be pain. You cannot really do much about this, but the only thing we recommend is at least you could try simple painkillers which will not have an effect, for example paracetamol. And then the other thing is, if the pain increases, please talk to your doctor, talk to your gynecologist, and then this will be very, very important. Our next point is actually we look at the commonest cause of cramping in pregnancy as gas and bloating. Gas and bloating is among the commonest causes of cramps in pregnancy. The main cause or the main reason is this. During pregnancy, there's a hormone called progesterone. This hormone specifically slows down digestion. You realize that when digestion slows down, then there are high chances that there's going to be indigestion. Indigestion brings about gas and bloating. The main solution to this is we advise pregnant mothers to make sure that they eat small meals throughout the day, and then go for foods which are easily digestible. And you could actually go for toast, you could go for crackers, you could go for porridge if at all it works out for you. But just make sure that whatever you do, whatever food you're having, you should have small meals throughout the day. We recommend at least you could even do like 5 to 6 meals throughout the day. There will be a constant supply of glucose in your system. And then the other thing is that you'll be full, you'll be satisfied throughout the day. So gas and bloating can be managed by having small meals throughout the day. And then of course, make sure that you slow down when you're eating your food so that there's easy digestion. Next cause of cramping in pregnancy, next cause of cramps is constipation. Constipation comes about as a result of indigestion, as we said in our previous point, and this is due to the hormone called progesterone. So constipation can be brought about by adjusting the diet. Go for foods which are easily digestible, and this will work out. Thank you for staying with me up to this point. Remember to like and subscribe to this channel so that you get more of these tips. I will send you the updates. I will answer all your questions. Thank you, my friend, and let's move on to our next point, as the commonest cause of cramps or cramping pains in pregnancy is sexual intercourse. When you are pregnant and you have sex with your partner, some women may get the pain, some women do not get the pain. So if at all this happens so often, you might need to go and visit your doctor so that some tests can be done. Probably there could be a urine test, urine tract infection, and this can be discovered by doing some simple tests. Ideally, you're not supposed to get pain when you have sexual intercourse with your partner, but if at all this happens and it persists, then we recommend you need to go and consult your doctor. Thanks a lot, and we shall go to our next point. Our next cause of cramps or cramping pains is ectopic pregnancy. Ectopic pregnancy is defined as an extrauterine pregnancy, or a pregnancy that is happening outside the uterus. After fertilization, ideally, the egg is supposed to go back towards the uterus, and then it attaches or it implants on the uterine wall, just as you can see in this diagram. But if at all implantation takes place outside the uterus instead of inside the uterus, then we call this an ectopic pregnancy. This is an emergency. it's actually an obstetric emergency. It's an obstetric emergency. We always recommend, if at all this pain is not coming down, the only way to discover that a woman is having an ectopic pregnancy is you do an obstetric scan. You do an ultrasound scan. The sonographer will be able to tell whether this is a normal pregnancy or it's an ectopic pregnancy. And once discovered early, treatment can be given. And when treatment has been given, there are high chances of recovery, and you can always go on and conceive once again, even if you have one fallopian tube. So, in summary, commonest cause of cramping pains in pregnancy is ectopic pregnancy. The only way to discover that this is ectopic or this is not ectopic, you do a pelvic or an obstetric ultrasound scan. Hope we are together, my friend, and we shall go to our next cause of cramps or cramping pains is miscarriage. Miscarriage is defined as a pregnancy that has failed to proceed beyond 20 weeks. The pregnancy that does not go on despite all the factors being very okay, then we call that a miscarriage. When you get cramping pains or the pains tend not to go away, actually it could be a miscarriage, more so if it is accompanied by a discharge. So my simple advice is, if the pain is there, lower abdominal pain, and then there is also a discharge that is coming out, it could actually be any color, but normally miscarriages present blood discharges coming out, and we would recommend, please don't sit at home, go and see your doctor so that a further examinations, further evaluations can be done to identify if it is a miscarriage. Then some checkups may be done to really find out what caused the miscarriages. Maybe it's a hormonal problem. Maybe it is a chromosomal problem. All this can be discussed to you. It can be told to you by your doctor. So if at all a woman is having pain, cramps which are not going away, please don't just sit at home. You can always go to hospital. They will do some checkups on you and they will tell you really what could be causing this. Thanks a lot, and we shall go to our next cause of cramping or cramping pains in pregnancy is high blood pressure. High blood pressure is an emergency. We always recommend all pregnant mothers to have blood pressure checkups whenever you go for antenatal care. The main reason is that you can easily discover high blood pressure in the early stages, and once discovered early, then there are high chances that you can manage. This can be managed very well. They can give you some medications, and these medications can keep down the high blood pressure, and you can proceed with the pregnancy. After delivery, this pressure, hypertension tends to go away, or it tends to normalize. Please, 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 all pregnant mothers, we advise that if at all you're getting cramping pains which are not going away, you're feeling dizzy, you're feeling heaviness behind your head, then this could be a sign of high blood pressure. And the only way to discover whether it's high blood pressure is you have to go to hospital and they have to check you. And once it has been discovered that it is there, treatment can be given. Next point is urine tract infections, or commonly called UTIs. As you can see in the diagram, you realize that UTIs or urine tract infections are among the commonest causes of lower abdominal pain in women. This does not really say that all women are prone to UTIs. No, if at all you go for short call, you excuse yourself in a place that is being used by many people, then there are high chances that you can easily get these infections. And once these infections go through the whole system, they can actually ascend upwards through the tubes. As you can see in the diagram just around here, they can ascend, and once they ascend, they can actually, when they are still in the tubes, we call this ureteritis. But if at all they proceed upwards up to the kidneys, then we call this pyelonephritis. Now, this actually can go to kidney disease. It can go to kidney problems. Something that started as a simple UTI, a simple infection. My advice is, if at all you are getting lower abdominal pain, and this pain is not going away. Simple. You have to go to hospital. They will get a sample of your urine. They will do a test, and this test is called the urine analysis test. They will analyze your urine, and then if at all they look at the parameters, and let us say the leukocytes, the white blood cells, are high, and then the acidity, the pH is very, very low, then there are high chances that there could be a UTI. And of course, evaluation can also be done to really discover if at all there are proteins in your urine, and also glucose. So we always advise, if at all a woman is having cramps and these are not responding to simple painkillers like paracetamol, then it could be a urine tract infection.